Welcome. We will be giving attendees a couple minutes to join. Thank you for being with us today. Welcome everyone. As you're coming in, we're giving just a couple more minutes to join. Thank you so much for tuning in today. Okay, we're going to go ahead and get started. So welcome everyone. My name is Whitney Emmert Bush and I'm the Regional Resource Director at Caron Treatment Centers for Florida. Thank you for joining us today for today's webinar on the topic, Working with Patients, Families, and Professional Contacts, How Ethics Influence Communication. As a reminder, we will be conducting this session in webinar format, meaning all participant microphones will be muted, so we will not be able to see or hear you. During the presentation, please utilize the Q&A feature to ask any questions. If you are unable to get to your question before the end of the hour, or if we are unable to get to your question before the end of the hour, we will have someone from our team follow up with you directly. Additionally, the slides and recording of the webinar will be emailed to you within 15 business days of today's program. Today's presentation is eligible for 1 continuing education credit. We would like to thank our educational partner, CE Learning Systems, for assisting and providing these credits through co-sponsorship with the American Psychological Association. Please note that in order to receive your credits, you will need to be on for the duration of the program and complete the post-webinar evaluation. A link will be emailed to you directly after the presentation from cego.com. After finishing the evaluation, you will then have immediate access to your certificate of completion. Okay, so today I'm proud to introduce our presenter, Heather Hafer. Heather has been with Caron since 2009. She's the clinical supervisor of the Women's Continuum at Caron, Pennsylvania, ensuring those patients receive the most effective treatment possible. Heather's responsible for supervising therapists and designing and implementing program schedules and treatment components tailored to each group's treatment needs. She's a certified advanced alcohol and drug counselor, a certified clinical supervisor, and is trained in both cognitive processing therapy and dialectical behavioral therapy. Heather's currently working on her PhD in addiction psychology. Again, thank you for spending your time with us today, and I'd like to welcome Heather. Thanks, Heather.
Thanks, Whitney. Hi, everyone. Thank you for having me. We're going to talk about how ethics influence our communication, working with our patients, our families, and our professional contacts. Before we get into that, we do have a couple learning objectives that we're hopeful to address throughout the course of the training. So the first one is defining both our personal and professional ethics and how those two influence each other. We're going to talk about and identify how our personal ethics impact communication with patients. The third one is the ability to identify appropriate ethical decision-making, specifically when working with those patients, their families, and the professional contacts. And then finally, exploring the importance of remaining curious, and specifically when defining personal ethics in our professional settings. Next slide. So ethics, I think in the world of healthcare and maybe just in the world of being human, ethics is one of those larger than life terms that we talk about a lot. And I don't know if we ever take a lot of time to really talk about the specifics of what ethics are. If you are to go through boards or licensing systems, even if you do a quick Google search, ethics is often described in a few of these different manners here. So moral principles that govern a person's behaviors or the conducting of an activity. It's been described as principles of conduct governing an individual or a group. It's also been described as a set of moral issues or aspects, specifically rightness, and then also described as a system of accepted beliefs that control behavior, especially such as a system based on morals. Those are a lot of ways to talk about ethics being this really gray space that we as humans, as healthcare professionals, have to explore when working with different clients and patients. A lot of times when we talk about ethics, we really talk about it in the way of having a code of ethics. We talk about it that there has or could be an ethical violation. And sometimes we even talk about ourselves or other people either having ethics or lacking having ethics. Ethics are really these very vague gray spaces that allow us to explore who we are personally and professionally, which then influences how we engage with other people. Next slide. So if we talk about personal versus professional ethics, and we really take it from those two perspectives, we as humans have both of these. So our personal ethics are going to be those that are defined for us by us. These are our personal beliefs, our values and principles. Sometimes they're ways of meanings. Oftentimes, as little humans or small children, we're taught certain things. We develop core beliefs around what people do or don't do. We're taught how to or how to not talk to others, engage with other people, even some behaviors that are or are not acceptable as we are growing up and we start exploring through our young adulthood and adulthood. So personal ethics are truly how we then define ourselves and what we find to be right versus wrong, good versus bad. And when we are developing ourselves, it's important for us to be aware of what our personal ethics are. A personal ethic might be reflective to social happenings or social values. It could have to do with the people that we engage with. And as healthcare professionals, I think it's important for us to be able to acknowledge that we do, in fact, have our own personal ethical code, whatever we define that to be. We'll get into that in a little bit. Then we have the other side of us. As healthcare professionals, we then have that professional ethical side. So professional ethics are typically or often practices and policies that are set in place by the frameworks that we work in and around. This could be a place of employment. Here at Caron, I have set expectations that as a professional, a therapist, and a supervisor, I would follow. As a healthcare provider, many of us have ethical codes, whether that's the APA, ACA, or NASW, just as a couple, but there are many ethical codes or codes of conducts that we are often directed to follow. Along with that, as professionals, when we're credentialed or licensed or have board certifications, those bodies will often direct us to a code of ethics or a code of conduct as well. Professional ethics, while could be similar to personal ethics, are often going to be highlighting how we do and don't work with our patients or our populations. So professional ethics are going to give us general principles around what is appropriate, how we do or don't act in our settings, but also what we are responsible for and how we engage with those that we work with. Having both personal and professional ethics is something that makes us a little bit unique, that we have to learn how to work with both of those in both of our roles as an individual and then as a professional. Next slide. So if we're talking about both personal and professional ethics, and then how they exist in the same space, we come to this place of ethical influence. So the question is really, can we as professionals practice personal ethics in our role? So as a healthcare provider, are we able to bring parts of who we are ethically into the space that we're working? I think it's important for us to recognize that we as humans are going to naturally bring those pieces of us into our professional settings. For me, it's inpatient treatment and any sort of healthcare experience. We need to be able to be mindful when our personal ethics or those personal codes are present. What we know is that our personal and professional ethical codes or values might not completely align at all times. That's okay. What's important for us to know is when that influence is happening. So if you're somebody who believes in one specific thing, maybe it's a religion or a spiritual practice, being able to recognize when that influence might be coming up in the work that you're doing with a patient or a community, and how you are outlining the different options for them or what they're working with. So when we know that our personal practice, our personal ethics are part of us as a healthcare professional, we also need to think about how those professional ethics then impact our personal code. So it's the back and forth between the two. If we know that personal can influence the professional, then we can absolutely assume that our professional ethics then impact and influence our personal code. This might show up with working with patients or working with clients where professionally we follow expectations of us, whether it's from our place of employment or our licensing boards, but also recognizing the internal struggle that might come up or maybe some internal dissonance when the professional piece might feel a little bit stronger or different compared to the personal ethics. What we often find is this is a chance for us to explore growth and to explore change with that personal code or that personal ethical experience, to expand that a bit more, and we start to see some alignment between the personal and the professional codes. In the healthcare field, when this starts to happen, what we start to look at is this idea of competence and integrity. In the healthcare field, it's absolutely important that we practice with competence and with inner competency. If we're doing that, then we're often following the professional ethical code or expectation that's been placed on us. In following that and working within our competency, we're able to then guide through integrity, responsible actions when working with other humans, patients, staff, families, or professional contacts. Because of following that competency and with working within integrity, then we're showing up for our patients and our clients as we said we would and as ethically appropriate. Next slide. So once we start to acknowledge both our personal and our professional ethics, and we start to recognize how they influence each other, we start to then explore how it impacts communication with our patients. What we have here are 5 general principles, and these are reflected from the APA's Code of Conduct. But these are principles that, in general, humans working with humans would typically follow. Excuse me. So the first one is fidelity and responsibility. This is the idea of the importance of rapport building with our patients. When we reflect on our ethical sort of guidelines and expectations of us, what we really want in communicating with our patients is the ability to develop trust within that relationship, and for the patient to have trust with us and maybe our organization. So when we look at fidelity and responsibility and we start to build the rapport, we then are able to build the responsibility of working with our patient and that community or that population. But we allow them the space to have open dialogue with us to truly work on the things that brought them either to therapy or treatment. In terms of integrity, This is our need to promote accuracy and honesty. It's essentially doing what we say that we will do for our patients, and saying what we need to say for our patients. So when we look at communication through an ethical viewpoint, when we practice integrity, we're being open, honest, and direct with our patients. We're providing them the feedback that they need to hear, maybe not what they necessarily want to. And ethically, we're doing it in a way that supports them because we've already informed them through our actions and through building rapport that we're there to do that work with them. Then we've got beneficence and non-maleficence. Growing up, many of us probably heard the term do no harm. And this is really where this comes from. So if we take this from an ethical perspective, this is about doing the next right thing, providing supportive care, seeking best services for our patients. When we look at it through both personal and professional ethics or our codes, what we're going to be looking at is how we support the patient where they're at, and also to help them to continue growing where they need to go. Justice is the idea of fairness for our patients. So when we take a look at it through our ethical codes, what this looks like is that we are ensuring that all patients can benefit from services, that it's not just a select few or a specific community. And then when we take the idea of professional ethics, really ensuring that that patient has the ability to engage in those services, whichever they are, and without judgment or potential bias. When we talk about being non-judgmental and we talk about not having bias, this is where both personal and professional ethics can influence each other. Really allowing the patients to be in a space that they're accepted and welcomed, but also provided with appropriate care. And then we have rights and dignity. So this is that all of our patients are worthy. All of them have the right to treatment and the right to care. In addition, it is us as professionals, really both personally and professionally, recognizing that we're providing ethical care, regardless of race, gender, socioeconomic status, or anything that would define our patients. Rights and dignity is often one of the principles that, regardless if it's personal or professional ethics, that both are aligned with, because it's the idea that we want people to be able to access care and become well. Next slide. Okay. So after we talk about, ethics, and we talk about those principles and how they can influence communication, once we start talking about ethics is when the decision-making has to happen. If we've truly put an eye to what our personal ethical code and what the professional ethical code is that we have instilled in us, then there will start to be some alignment of both of those. What we'll see is that influence that we referenced earlier becomes more and more significant. And typically we see some joining, so to speak, of the two types of codes. If we're practicing ethical decision-making, what we start to do then is we start to have eyesight around potential ethical dilemmas around communication when we're working with our patients and the people around them. When we have insight to both personal and professional ethics, and we recognize an ethical dilemma that's happening, there's steps that we can take so that we can start to address them quicker if they've happened, or preemptively if they haven't yet. So the first one is supervision, and this can be either in an individual or group setting, but supervision can be a wildly effective tool when needing to talk about any ethical decisions that need to be made or potential ethical dilemmas that we're experiencing. In supervision, whether one-on-one with your supervisor, with your clinical team, or even a multidisciplinary team, it provides the space to discuss what's happening, talk about how our personal ethics may have influenced the experience, how we need to realign with our professional ethics, but also it gives us the space to hear and receive feedback around how other people may have perceived the experience, or even what they may have done in those times. So when we think about the idea of feedback, what we get is the experience of hearing other people's influence of personal ethics in their professional setting. We get to experience how other people align their personal and professional ethics, and then we get additional resources. So when we start hearing those resources, we have the ability to then recognize whether there's steps we can take or what other ways we can access support when we're making these decisions or addressing dilemmas. Support might be seeking other supervision in terms of like an outside supervisor or other support groups. It could be training opportunities, and it could be case conceptualization. But the resources and support of this part of the ethical dilemma experience allows us to recognize that there's always ways that we can do different and better, and we can continue to work on aligning both our personal and our professional ethics. When we have the resources and we have the support, we can move into plan development. Through the feedback and the support, if we then take the ideas that we've talked about and we take the decision making that we've worked on, we can create a plan for other potential ethical experiences and dilemmas that we might have in the near future. Working in healthcare, there's often a time that there's something happening, and it doesn't always have to be an ethical dilemma, but there's often decision making that needs to be happening. So with plan development, it allows us to either be proactive or create potential plans for when we're in these positions again. All of those build into this idea of proceeding mindfully and with action. Coming from a true DBT skill set, we talk to our patients here at Caron around the STOP skill, and this would be the exact same thing. As healthcare professionals and people who are making ethical decisions, it's imperative that when these experiences happen, we stop. We need to actually figure out what's happening. And when we stop, we start to observe. So what is the decision that we need to make, or what is the dilemma that we're experiencing? What are the ethics that we feel are coming up? And what are some that we're not quite sure if it's appropriate to address or not address? Once we start observing all of those pieces and we really start to observe how we're reacting in that situation, we're able to tap back into either our professional or personal ethics, and then we can start to proceed mindfully. Proceeding mindfully is all about knowing where we're at, working with our team, checking in with our other healthcare professionals, and then we can go on with our plan or our action. Next slide. So all of those pieces then come into how do we work with our patients, our families, and our professional contacts, knowing that our personal and professional ethics are influencing our communication. So with our patients, the number one step is building rapport. It's one of those basic principles that we talk about. And ethically, it's difficult to create a relationship with a patient if we don't spend time building rapport. This could be just being with the patient, getting to know them, and also them getting to know us with appropriate disclosure, but being in a space that allows them to learn what it's like to work with us. And for us, recognizing where our ethics fall, either on that continuum of personal versus professional. This would be a place where we would recognize, am I somebody who is comfortable disclosing or not? Am I somebody who historically I'm much more comfortable sitting in the therapist role and purely being focused on the patient? Or am I somebody who's willing to sit there in that space and maybe find some similarities in terms of hobbies or maybe music to increase comfort with the patient? But building rapport is going to be something that, depending on where we sit with that code of ethics, we really will define what that means with the patient. If we're able to build rapport, we then need to move into open and direct communication. So with this, we hopefully allow the patients a space where they then mimic or parallel our open and direct communication. The goal in working with other patients is to work them towards their goals and achievement, whether that's in a place of sobriety, mental health support, or overall wellness. And to do that, we need them to be able to communicate with us. When we start talking about our personal versus professional ethics, this is going to be a space where, again, that disclosure and that encouragement might need some support. For the patients, when we're working with them, for us to be mindful where we are in terms of our ethical code and what we find to be appropriate and comfortable in working with the patient so that they feel supported, they feel as if they are having access to appropriate care, and then for us to stay within our place of competence. As we start to really look at how our personal and professional ethics influence how we interact with our patients, that third bullet point is the one that tends to come up the most. So for us, we need to recognize when we have assumptions, expectations, and perceived ideals of the patient that we're working with. And when we're able to recognize that we have them, we need to challenge them. So when we look at this through an ethical lens, we need to recognize when we believe a patient is or is not able to do something. Do we assume that this patient is able to manage their symptoms of anxiety? Do we assume that this patient is going to struggle in early recovery? Do we assume that this patient will or will not show up for their next therapy session? We need to challenge assumptions and be able to be uncomfortable with ourselves when we have those assumptions so that we can challenge them in a place that we remain open-minded with our patients. It's the same with expectations. If we're working with a patient, do we have an expectation that they'll come to every session in a timely manner with all completed work? Either it's a treatment assignment or something that we wanted them to talk about with a family member. And if we have those expectations, are we able to communicate them appropriately with our patients? It's okay for us to have expectations with our patients if we're willing to have communication with them, and if we're willing to be comfortable enough to own that we have the expectations. Ethically, it's important for us to share that with our patients so we don't put them in a place that when they do show up for their next session, or maybe when they don't show up for their next session, that we can talk about how we are impacted and how it then impacts their care. Same thing with perceived ideals. If we have a certain perception of a client that we're working with or a patient, if we have a certain perception, maybe around their substance use or a diagnosis that they have, it's important that we then take that into supervision, whether with a team or with a supervisor, so that we can talk about what the perception is, how it's influencing us, and ethically how we do or do not address that with the patient and in supervision. Next slide. Okay, with families. So communication with families, somewhat similar to patients. However, oftentimes we have to ask ourselves, what is different when working with the family versus when working with the patient? So with the families, we have to have this question, this curiosity around who is protected by confidentiality. If your primary patient is the patient, maybe not mom, dad, or significant other, the hope is there's a signed release of information. And oftentimes, family systems also want to be protected by confidentiality in terms of them discussing things with you, but maybe not necessarily talking about it with the patient. So what this might be are things that they tell you and things they might not necessarily want you to share with the patient, and how it may then impact the relationship that you have with the patient and the family has with the patient. For example, I work in residential treatment with women. There's been times where we've had significant others during their initial phone call talk to the primary therapist about their desire to start a divorce proceeding, that they're no longer willing to be in this relationship, that the addiction is too much, and that for them, they're ready to move on. We've had instances where families then don't want to talk about that in treatment. They ask the primary therapist to keep that confidential. Do not share that with the patient. I want to work on that with you or the family therapist. And we get into this space where our ethics then come up. As a therapist, as a healthcare worker, we have to assess what the next appropriate step is. Is it ethical to keep that information from the patient? Do we work primarily with the spouse or the significant other around their desire for a divorce while continuing one-on-one therapy with the patient? Or do we work with the family system after, talking about the different options around the importance of ethics and sharing that information with the patient? Maybe giving them both a space so that while the one person's in treatment, they can process through what a divorce does or does not look like, how it might impact treatment experience, how it might impact early recovery. So the communication between family and therapist or healthcare worker then starts to include the patient. It's the same example if the family calls in and there was a death in the family. Really working from a place of your ethical code to communicate with the families around best and worst times to tell a patient, but also how to support them through that communication process. A lot of times what we need to do is talk about the most appropriate day and time to inform a patient, how we support them once they hear that information, what other resources are around for the patient, and doing the same with the family. So when families are sharing information with us as healthcare workers, and at times asking for either confidentiality or for now to not share that with the patient, it's our ethical responsibility, regardless if it's personal or professional, to have communication with them around the importance of including the identified patient in the discussion and in the decision. This can also show up when the patient knows that we're working with family and may have information that they're not quite ready to share with the family, which then impacts our communication with the family system. For example, if we have a patient who had some behaviors in active addiction that they have some fear and shame around, they may not be ready to share it with the family because of perceived ideas around the family, maybe how they believe they may react. And while they've been very open with us as a healthcare worker, they've asked us not to share with families. Our ethical responsibility there when engaging with the patient is encouraging them, when appropriate and ready, to share that information with support with the family so that they can at least A, share it, but B, share it in a place that they have support, but also have somebody engaging with them. Oftentimes what we see is when the patient feels supported to communicate with the family because we've made a healthy ethical decision, the communication process between the families and the patients can start to increase or at least get better than it was. We also see families being more willing then to engage in some of those more difficult conversations with their identified patient because they've had that communication. As we continue to work with our families, it's important that we reflect on ethical decision-making and we reflect on those codes that we referenced in the beginning of training and how we recognize and rectify what decisions we need to make versus what needs to happen with the people we're working with. Next slide. So then we have professional contacts. A lot of times when working with the identified patient, we have other professional contacts that they've worked with, or if you're in a more inpatient setting, they could be referrents who helped that person come into treatment. So with professional contacts, very similar to working with families, we want to ensure that there's releases of information so that we can have communication process. It's an easy ethical dilemma or an ethics violation when we don't secure releases of information and we engage with professional contacts. There's the potential for disclosure that we don't want to do. So making sure we have releases of information. In addition, with professional contacts, we want to make sure we have the appropriate contacts when working with our patients. So with our patients, what we want is knowing who their outside providers are. Did they have a different therapist or a psychiatrist before coming to us? Maybe they had a primary care physician. Once we recognize who the contacts are, then we have to see who is the most appropriate for us to be communicating with. For a patient that comes into substance use treatment, if they have a co-occurring diagnosis of trauma and depression, it would be important for us to have communication process with their outside therapist or their psychiatrist. When we have those releases, we then have to have some ethical ideas around the protection of information, similar from patient and family, when talking with professional contacts. So when we have the information being received from the professional contact, for example, a patient comes into treatment or therapy with you and they came away via intervention. The assumption is the interventionist is going to provide us with a wealth of information. Ethically, what do we do next with that information? As clinicians, as healthcare workers, it's important for us to reflect what we do next. Do we openly share all of this information with the patient? Do we use it so when we do assessments with our patient or the family, we have prior information that might provide more insight to what our patient's now sharing with us? Or do we invite the patient to talk about some of the pieces that brought them to treatment, find what does and does not align with what was provided to us, and then assess from there? It's the same thing with professional contacts and family. So oftentimes the family will then share information that they shared with the professional contact. Being able to make some decisions around what we do with that information is important. And, gently how we do or don't share that with the patient. In terms of professional contacts and information going to them from the patient, it's also important to be able to have communication with our identified patient around what they're comfortable being disclosed. So regardless of release of information, it's important for our rapport with our patients to remain in a healthy space and being able to be open with our patient around what professional contact communication looks like. Letting them know if we are doing updates, when we're doing them, or how we're doing them, if they're phone calls or emails, but also the potential to invite the patient to be part of that communication. So in this example, a patient came into treatment by way of intervention. It could be an option to invite that patient to be part of that update call with the interventionist, so that rapport continues to be built. We're practicing integrity because we're doing what we said we would, and they can hear what that update looks like. It also allows us to have a really great moment with both the professional contact and the patient to work in a really ethical way of putting all of our information in both of their spaces so they know what we're seeing. It also gives us a chance to work together for the patient to improve or increase whatever skill or wellness they're working towards achieving. And also for the interventionist to have information for whatever comes next. And that could be a therapist or a psychiatrist or any other professional contact. As we're talking about all of that and we're doing the work with the professional contact, it's really important for all of us to be very, very aware and remember the role of all parties in reference to the identified patient's care. So for that identified patient, if we have professional contacts and if we have more than one, being able to practice some awareness around who is or is not primary in terms of contacts to receive updates, and including the patient in that conversation around who they're hopeful to share that information with. Next slide. If we're practicing ethical decision-making and we're recognizing where our personal and professional ethics are, in order to do this, we absolutely have to remain curious. By remaining curious, we allow ourselves to continue to grow in these areas. To do this, we have ethical conversations, whether this is in team meetings, case conceptualizations, it could be in supervision. But I would encourage you to have ethical conversations around cases, decision makings, and potential dilemmas. The more we talk about these pieces and the more that we provide energy to them, they become less of a scary thing and more of something that we're just willing to talk about. By exploring the dilemmas, we also get to explore potential actions and plans. So when we do have something come up or we do have an experience that we weren't expecting, we've game planned, we've practiced what we might be doing next. As healthcare providers and people who work with other people, training and exploration is probably one of the easiest ways to remain curious. By doing this, I would encourage you to seek out trainings on ethics that aren't just the stereotypical every 2 years, 3 hours ethics training. So maybe it's something specific to a community that you identify with, or it could be for a certain population that you really enjoy working with. But exploring different training opportunities so that we can continue to talk about ethics. The last way you can remain curious is actually defining a personal ethical code. So we talked about it in the very beginning. We as humans have these codes. We have morals and values that we live by. We as healthcare workers have professional codes, and often they are given to us, or we apply for licensure and certification, and then we get those along with that. But we as humans don't get an ethical code when we're born. We get the opportunity to develop that. So to remain curious, I would encourage all of you to start exploring what that would look like. What morals, what values do you align with? What are things that you feel strongly about? Once we start to define what a personal ethical code is, we get to then align that with ourselves as a healthcare worker. We have the assumed professional code. We know that. And once we start to develop a true personal ethical code, we can take both of those and we can start to identify who we are as a person and as a healthcare worker and where our ethics lie. So we almost get to go into that gray space of ourselves that we have a combined personal and professional ethical code and a code of conduct. If we can do that, we've remained curious. We've encouraged ourselves to explore a little bit more. We've encouraged ourselves to really talk about how we do or don't align with certain things. And we've also allowed ourselves to remain open to what ethics may or may not be for us. Thank you so much for having me. I really enjoyed speaking so far. Whitney, I'll give it back to you.
Thank you, Heather. That was a great presentation. We will now move on to the Q&A section where we will answer some of the questions that were submitted through both the registration process and through the Q&A feature. And then we will follow up with any questions that we do not have time to answer in directly with each person who's asked. So first question is, say you have a session that goes really well, a positive session with the family and the client. What do you do if you feel like the communication will not go well afterward, or you are concerned that there will be anger or fallout?
Great question. I think this is probably something a lot of us often feel or have experienced. So I think a lot of times when we're having communication with patients and families and we're doing maybe a family session or some sort of combined conversation, our presence or the presence of a healthcare worker often provides support. So a lot of times the conversation can go really well. I think for us, the follow-up is where we can sort of move into that middle space, that if we have concerns around the next conversation not going well, or maybe the next time patient and family talk to each other, that there might be a blow up. If we can get in front of that and we can follow up with both patient and family, we then give them the space to talk about anything they didn't touch on. But it also allows us to say, like, hey, really proud of the work that you did. Here's my concern. And I think when we own that we have concerns, it allows our patients and our families to then be invited into sharing their concerns as well. So if we can get in front of it, and we can check in and follow up, I think we can do some coaching in that space as well. Then if they do call, let's say, our patient calls later that day or the next day and their phone call doesn't go well or their conversation doesn't go well, we talk about it, right? So, hey, we had this phone call, we had this family session, here's where we were. I followed up with you, we prepped what the next call was, this is how it went. Let's talk about where that went. Let's talk about where the communication breakdown was, or let's talk about why we said this versus that.
Wonderful, thank you.
Yeah.
Next question is related to addiction treatment. I see mixed reviews on therapists disclosing their own recovery experience or non-recovery experience. Is there a standard?
I don't know if there is. I think that it's definitely going to be leaning in that personal ethical code. What I would say is there's more concern around if a person is leaning on just their recovery experience as means to connect with the patient. I think we as humans and healthcare workers, we disclose sometimes without knowing it, right? I walk into my unit, I have a ring on my left finger. There's an assumption about me. I've disclosed that I have a partner. You come into my office, you're going to see my 3 dogs on a picture. I've disclosed that I've had pets. But my marriage, my pets aren't part of the therapy that I provide. So I don't know if there's a specific expectation around therapists sharing or not sharing their recovery or lack of recovery if they're not somebody who identifies. I think it's more of how does that influence the therapeutic rapport and the session and the work that we're doing.
Thank you. Okay, next one. If you have an ethical conflict with the patient's behavior and you truly cannot move past it, do you decide to tell the patient you can no longer work with them? Do you tell them the truth, or is there an appropriate way to part ways?
I think first step is supervision. I'm a huge proponent and a huge supporter of supervision. Even if you wake up and you feel like it's a great day, seek supervision. But this is a great question. So if there's a behavior that we really struggle with, we need to seek supervision for any transference or potential countertransference that's happening for us. We need to explore what is happening that's impacting us, because what we know about the therapeutic relationship is it's not just the patient, it's both of us. So as much as I hopefully influence them in a really healthy way, their behaviors and actions are also going to influence us. If through supervision, we're still in a place that we do not feel as if we can have an ethical, appropriate relationship, or we're in a place that I'm not the best fit, then I think it's appropriate to discuss with the patient around their behaviors, the struggle that's happening. I think it's okay to talk about why the relationship is ending. But we as professionals and working in competence, we then share who they should be seeking out next or where that relationship goes with another provider. And it could just be that we've done our time with that person, so to speak, and we've done all of the clinical work that we can, and the next person is who needs to work with them.
Wonderful. We've got some great questions coming up too. How can you manage being a mandated reporter, but also have a patient completely open up?
I think it is what it is. I think, I'll speak for us. When we meet with our patients, we go over an orientation, and we're very clear from the beginning that we are a mandated reporter and what that looks like. I think as healthcare professionals, it's important for us to be very transparent that we are mandated reporters and what that means. I think sometimes it's very easy to just say the words, but not explain it. Same thing with, we have ethics and we don't often talk about it at length. So if we're able to have a very open dialogue from the beginning with our patients around being mandated reporters, we're going to allow them the space of sharing with us. And if you have done a fantastic job of building the rapport, that they feel comfortable completely opening up, and there may be something they've shared that mandates a report, we still have that rapport, hopefully, that you can engage with them around what they said, what the report is, but also what the next step is, right? So I think it's important whenever we make a mandated report that if we're really working through an ethical viewpoint, that we go through that whole step with them, sharing what we reported, why, but also what could happen next. And sometimes it's a lengthy experience, and sometimes it's a couple phone calls, but I think being able to communicate that with patients is really important.
Wonderful, thank you. This next one pertains to communication with families. When an ROI is given to certain family members, but not all, how do you manage communication with the family when you feel strongly that they are passing on the information to the family members without an ROI?
Great question. Be 100% direct. From the very beginning, if your personal ethical code doesn't include it, our professional ethical code does, we need to be very direct, open, and transparent with our family systems or whoever we have that ROI with. So, if we are working with Sally and Sally's mom has a release, but dad does not, it is our duty to be very clear with mom who does and does not have a release and what that means. If we then have a feeling, or, sometimes the patients call or our families talk with our patients and dad's talking to Sally and he knows something we shared, it's then our responsibility again, because Sally will bring it to us when we speak with mom next, to address it. It's important for our families. It's important for our professional contacts to understand that redisclosure is not appropriate, and how that can harm either the patient's rapport with us, the patient's connection with family, but also the work that they're doing.
Thank you. What if the ethical standards of your company do not match the current ethical standards of your industry? For example, in drug and alcohol treatment, several programs still do not offer medical or medication-assisted treatment. However, it is an acceptable form of treatment. You have a patient who would like to explore it. How would someone manage the request?
So I can't speak for the specific program, obviously. I would encourage you to talk with your compliance department, to be honest. You're absolutely right. MAT is an appropriate treatment method, and us working in the addiction field, we've seen the benefit of MAT, and especially, our comfortability as a field around MAT over the past couple of years. If you work at a facility or a program that does not align with that, and yet you are ethically supportive of it, I think that it's appropriate to have a conversation with your compliance department or whoever that is whether it's quality or compliance, to be able to talk about the concerns. It could be something that it's a standpoint for that facility. Maybe it's something they haven't addressed yet and they haven't looked into implementing in that program. But I think we as professionals and people who work with people, sometimes it's our ethical duty to advocate for them, even if the patient doesn't know that we're advocating for them. It could also be something where, I don't know if it's inpatient or outpatient, but maybe we provide recommendations to that patient when they're finished with us, how they then seek out MAT so that they can continue with that request.
Thank you. Okay, next one is, as a presenter, how do you integrate your personal ethical code with topics such as ethics and your professional code of ethics?
Supervision. I don't want that to be a repeat answer. But I think supervision is just wildly important. I think, I've played many roles in my time here at Caron, and I think it's been important for me in my growth and now as a presenter of really recognizing what my personal code is, but also recognizing that when I step foot into my organization, my office, this presentation, I also have to align with whatever that professional code is. And there may be things that don't quite fit together. And when I'm here, when I'm at work, when I'm presenting, I'm Heather, the healthcare professional, not just Heather, the human. So while I do have pieces of me that I'll bring to the table, pieces of me that help me be an effective therapist, the professional part is really what takes the primary stance.
Okay, thank you. And I think we have time for one last question. What if you are aware of an incident, but the patient has not disclosed it to you yet, or you can tell does not have plans to, however, it would be a significant part of their treatment?
I would talk to the patient. I think we are working with our patients or our clients and oftentimes promoting honesty and integrity, promoting direct communication. I think it's important for us to reflect that with our patients. So while there may be something that has either happened or experienced with our patient that they might not be ready or willing to share with us, because that does happen, I think it's the responsible action and probably the ethical decision for us to have a conversation around it. So whether that means we're bringing it to the patient, hey, I heard, or somebody shared this with me, can you talk to me about this experience? It's at least putting it out there on the table and inviting them to be part of the conversation. I know oftentimes patients or clients, when they are not ready to or willing to, there's a lot of discomfort being the first person to disclose or to share. So if we can invite them to be part of the conversation, we can start that process with them.
Wonderful. Thank you so much again, Heather, for your informative presentation, and to all of our attendees for joining us today. As a reminder, this presentation is eligible for 1 continuing education credit. Watch your email for a link from cego.com to complete your evaluation. I'd also like to remind you that the slides and recording of the webinar will be emailed to you within 15 business days of today's program. Please register and save the date for Caron's 8th Annual Addiction Research Symposium with both in-person and virtual options, where we showcase the latest in addiction research and treatment. Additionally, please stay connected with us for our next continuing education program by visiting www.caron.org/webinars. In the meantime, please reach out to your local regional resource director at any time for additional information, resources in your area, or questions regarding admission to any of Caron's programs. Thank you so much for joining us, and have a wonderful afternoon.